Hi, everyone, and thank you for joining. I'm Dr. Lawrence Borges. I'm the Chief of Gastroenterology at Mount Auburn Hospital in Cambridge, Massachusetts, and I'm excited to speak with you today. Um, Today, I want to talk to you about something we all experience but rarely talk about, gas or flatulence. Now, you may be surprised to learn how common and how normal it really is. But when it becomes uncomfortable or embarrassing, it's worth understanding why we get it and potentially what we can do about it. So, to start, let's talk about what is flatulence. Well, simply put, flatulence is the passing of gas through the digestive tract, through the rectum, into the air. It's something every human does, typically 10 to 20 times a day. In fact, most people who think they have too much gas are actually within the normal range. The gas we release is mostly like the ambient air, so it includes large proportions of nitrogen and hydrogen, smaller proportions of carbon dioxide, and sometimes methane. And despite popular belief, the gas we pass is typically odorless. However, the odor, when it does occur, comes from trace sulfur compounds made up by bacteria in the gut. So where does this gas come from? Why do we have it? Well, one of the major drivers of gas is swallowed air, or aerophagia. And this can come from eating, particularly eating too quickly, drinking, particularly drinking carbonated beverages, or chewing gum. Another large source of gas is fermentation of undigested food by gut bacteria. And this is typically from complex carbohydrates like fibers and sugars. It mostly occurs in the colon, and it's a normal part of digestion. So how do we know, however, what's normal and what's excessive? Well, again, normal gas is passing gas 10 to 20 times per day, believe it or not. However, it can be excessive, and we sometimes define excessive as when it causes pain, bloating, a foul odor, and particularly when it's socially disruptive. Now, importantly, because this is a misconception people often have, the discomfort from gas is often due to sensitivity, but not actual to gas volume. And the lower image here is just showing an image from a physiologic study done a long time ago that demonstrated this. So people who feel gas sensation are not necessarily more full of gas, they're just more sensitive to it. So we've talked a little bit about where it comes from, why we get it. Let's talk about the common causes of excessive gas to know how we can, hopefully intervene. Well, the most common thing that we talk about with patients in the clinic is going to be gas-producing foods. And as you might expect, this includes the sort of usual suspects: beans, lentils, onions, cabbage, and dairy. Now, this is just an image, that may give some of us anxiety from the Whole Foods shopping counter. But let me pull up a chart. This is from a physician reference called uptodate.com. And this spells out nicely some of the foods that are commonly associated with gas and bloating. There are other ways we could get it as well. Again, we mentioned aerophagia before, so swallowed air from fast eating, carbonated drinks, chewing gum. Artificial sweeteners is a common category that people may overlook because we use them so commonly in foods like coffee, tea, etc. And then interestingly and importantly, normal day-to-day activities like airplane travel can produce changes in atmospheric pressure that cause you to feel and expel more gas. So if you're traveling and having that as an issue, it's not necessarily something to worry about. So let's talk about when you should be concerned, right? We know that everyone's going to have gas, and we know that for the most part, having gas is normal. But when should you be worried? Well, certainly if you're experiencing a lot of flatulence and you're having unintentional weight loss, if you notice blood in your stool or ongoing change in bowel habits, particularly like diarrhea, if you experience new or worsening abdominal pain or discomfort, or nighttime symptoms or fevers. These are the so-called red flag features that we would want people to think about and be aware of, and you may bring up to your doctor. What would happen then? So if you're noticing a red flag feature and you're having flatulence, it's possible that some tests may be considered. Those tests would include things like stool tests, specifically looking for fecal fat content, fecal elastase content, and also infectious stool tests like Giardia, for instance. Breath tests are also very popular now. These are tests designed to look for things like small intestinal bacterial overgrowth, as well as lactose intolerance. Blood tests may be utilized. In particular, we often think of celiac disease if somebody comes in with excessive flatulence and GI symptoms. And then possibly further down the line, your doctor may consider an endoscopy or a colonoscopy for further evaluation. And I would point out that this is more often to be considered if there are alarm features present. So now the part we've all been waiting for, right? What can you do? So you have gas. We recognize it can be normal, but it's bothering you. What can you do? Let's start off first with diet tips, because remember we said the big category we always talk about is the foods you're eating. Very important to try and keep a food and symptom diary. Now, this is a piece of advice that we hand out in the office a lot, and sometimes I see people's eyes glaze over. Yeah, doc, I'll try. But truly, it can be very important, because if you keep a diary of what's bothering you and giving you more gas, that result is going to be more relevant to you than something you've looked up on the internet. Then, with that information, you want to limit gas-producing foods and test your response. So you can then try a controlled trial of saying, well, I ate this food last week and I felt like I had more gas. Let me get rid of that and replace it with something else for the next 2 weeks. And you can use charts that you might find, like the one I showed earlier, to help determine what's good and what's not. Also consider a low FODMAP diet. So I imagine this is a diet that you've all heard of, seen, talked about. Stands for fermentable oligo, di, mono, and polyols. And it refers to the carbohydrate content of certain foods and how they're digested. If you're not having success with the typical foods, reducing beans, cruciferous vegetables, etc., looking at the low FODMAP diet specifically can be a very effective way to target what's causing you to have the symptoms versus somebody else. And I mentioned here that it's sometimes helpful to do this with guidance from a dietitian. Certainly us in the gastroenterology world are happy to talk about these things, but dietitians are specifically trained to talk through these changes and these strategies with patients and can be very, very helpful. Next, let's just talk about what you can do from a lifestyle and potentially medication perspective. So as I mentioned, aerophagia is the source of gas. It's important to eat slowly and avoid swallowing excess air when you do. This means, no more eating on the run. Life is hectic, but sometimes it's important and helpful to sit down, chew thoroughly, eat your meal slowly. Sometimes walking after meals can help to move gas around in the system, help you to expel it more easily, and potentially help you to expel it more regularly so that it's not building up and causing you a problem when it's socially uncomfortable. And then how about medications to consider? Well, this table shows you some of the common ones that are available over the counter. The first one is lactase. So this is going to be like your Lactaid type supplement. It breaks down the lactose protein. Sugars, It's specifically for people with lactose intolerance, but it's something worth testing if you're not sure if that's what's bothering you. Alpha-galactosidase is another enzyme supplement that you'll find, or you can find this over the counter. This is meant to break down complex carbohydrates and reduce gas from beans and cruciferous vegetables. Probiotics is a category that people often get a lot of enthusiasm for, and it's possible that this may help modify your microbiome and modulate the gas-producing bacteria in your system. Lastly, simethicone. So this is found in medications like Gas-X, and what it's meant to do is reduce the surface tension of gas bubbles in the body, making the gas easier to expel, rather than spreading out through your digestive tract. Now, I do want to make an important point that while all of these medications in different forms are available over the counter, and I think worthy of a trial, the evidence to support their use in this area from an evidence-based medicine perspective is actually fairly limited. But nonetheless, we think that they're unlikely to hurt you and so worth a try. So I want to leave you with a couple of take-home messages. First, importantly, gas is normal. Like I mentioned, we may pass gas 10 to 20 times a day. This is to be expected and is a normal part of digestion. However, bothersome symptoms can occur and they can be managed. How do we manage them? First, you want to track your triggers, specifically dietary triggers. Adjust your diet accordingly and use simple remedies, eating more slowly, walking after meals. Lastly, speak to your doctor. If you're worried about it or you're not having the success you want, feel free to speak to us in the clinic about it, raise it as an issue. There's no need to be embarrassed. Certainly, if you have the alarm features that we spoke about, you'll want to bring that up. But even if it's just something that you're not able to tackle, it may be worth a conversation to see what you could be doing differently. So thank you for the opportunity to talk to you, and I hope this was helpful.